I will confine my comments to those aspects of the bill that are pertinent to psychiatry, namely Head 4. Head 4 is concerned with the risk of loss of life from self-destruction. It has major implications for psychiatrists. The first point I want to make is that there's a fundamental difference in the management of medical and psychiatric emergencies in obstetrics. In obstetrics, medical emergencies and psychiatric emergencies require very different interventions. In a medical emergency, speedy delivery of the baby is necessary. In a psychiatric emergency, speedy delivery of the baby is contraindicated. It's exactly the opposite to that required in a medical emergency. In a psychiatric emergency, such as when a patient is depressed and has suicidal intent, the patient may have impaired capacity and should be advised in that situation not to make irrevocable decisions. The patient probably cannot give informed consent. Those of us who see people who are with suicidal intent often see people who are desperate, who feel completely overwhelmed, who are often agitated, who feel hopeless and feel very unsupported. The person in that situation often has what's called cognitive constriction and can see no other option in front of them except ending their life. Such a patient needs professional help, not an urgent termination of pregnancy. My second point relates to the fact that psychiatrists are judges. Psychiatrists are doctors, not judges. If Head 4 is enacted, psychiatrists will be asked to determine if there is a real and substantial risk to the life of the mother, in order that the mother may procure termination of pregnancy. This is a role that Irish psychiatrists have not been involved with to date. I think that many Irish psychiatrists will not see this as their role as medical practitioners. The role could be construed as making psychiatrists the gatekeepers to abortion. Psychiatric practice relates to the assessment and treatment of patients, not assessment and adjudication. Psychiatrists are not judges.